Bone strength is a common issue among the elderly, but what most people don't know is that what they do in younger years can actually have a significant impact later in life. The thing is that in healthy people, bone production exceeds bone destruction up to about age 30. After that, destruction usually exceeds production. That's why it's important to maximize bone strength up to age 30. In a previous video, we've talked about osteoporosis and how milk and calcium in particular contribute to healthy bones. If you haven't checked that yet, remember to take a look at it after this video. It will help you gain a deeper understanding of the topic. In this video, we'll address the specific contribution of protein to your bone health. If you've searched the topic, you've probably found contradicting information about protein for bone health. Protein is important to the integrity of bone at all life stages, and its restriction has been shown to cause a reduction of intestinal calcium absorption, which is also an important nutrient for bones. Further, higher protein has been associated with less complications after a hip fracture and general decrease of bone loss in the elderly. Several studies have documented the benefits of using protein supplement for hip fracture patients. On the other hand, it is also argued that excessive protein, particularly animal protein, is harmful to bones. Some other studies suggest that high protein intake leads to higher calcium excretion, which, again, plays an important role in bone health. Several worldwide surveys report that the countries with highest animal protein intakes are those with highest hip fracture rates. Thus, it follows that a high protein intake would lead to bone loss. Well, but not all protein is the same. What about vegetable-based protein? While some may argue that it is healthier overall, researchers haven't found much differences regarding bone health. In fact, it's suggested that animal protein is linked to higher levels of insulin-like growth factor, or IGF-1, which is good for bones. In terms of sources of protein, it should be mentioned that some studies report that the increase in urinary calcium observed after the use of purified proteins or amino acid infusions is not readily observed with food sources of protein. To make a quick status on what we've learned so far, protein is good for bones because it favors bone formation, is associated with faster recoveries post-fracture, and its lack causes less calcium absorption. On the other hand, high-protein diets are associated with higher rates of hip fractures, which can be explained because it makes the body expel more calcium in urine. Apparently, these are contradicting pieces of information, so researchers dug deeper and found two important issues that can make them reconcile. The first is that although protein leads to more calcium excretion, it also leads to higher calcium absorption, and the balance results are not necessarily negative. It all depends on dietary calcium intake. One study concluded that only people with high-protein diets improved bone mass density when taking supplements of calcium and vitamin D. There was no benefit from supplementation among those with lower intakes of protein. This means that protein itself is not the issue behind bone loss among people who have high-protein diets. Which leads to the second thing researchers found. Calcium excretion is actually a mechanism of the body to maintain its acid base status. As it happens, foods containing high levels of protein, such as meat, fish, and eggs, are acidic and require the body to release more calcium, and that's why they lead to bone loss and ultimately more fractures. However, that doesn't have to be the case if the diet as a whole include foods that balance the acidic nature of protein sources. Potassium-rich foods are especially important in this regard. So, the proposed explanation for the studies suggesting animal protein leads to higher hip fracture incidence relates to the fact that contemporary cultures consuming a high animal protein diet also tend to underconsume vegetables, fruits, nuts, and seeds, which are base-forming foods. Please don't forget to subscribe to our channel if you're curious about science applied to health issues, and hit that bell icon so you receive the notifications every time we upload a new video. In summary, protein has an important role in improving bone density. However, it is important to balance a high-protein diet with adequate calcium intake, and also vegetables and fruits to counterbalance the acidic effect of protein-rich foods. Another crucial nutrient for bones is vitamin D, and if you want to understand more, then check our next video on the importance of vitamin D for bone health.
Please note this video is our interpretation of scientific papers. It is merely informative and doesn't constitute any form of advice. If you have any health issues or concerns, please contact your physician or licensed health professional.